Understanding Anxiety Disorder, a comprehensive guide for the counseling professionals. Anxiety disorder are characterized by excessive fear and anxiety, and along with related behavioral disturbance, and also involve excessive fear, worry, or anxiety and related behaviors. They affect daily functioning. The DSM identifying the several distinct type of anxiety disorders, each with a unique and diagnostic criteria. This include generalized anxiety disorder as characterized by the chronic and then excessive worry. And the second one is panic disorder, is marked by sudden and intense episode of fear, known as panic attacks. And the third one is social anxiety disorder or social phobia, where individuals experience extreme fear of social situation. And the fourth one is specific phobia. It involves intense fear of particular objects or situations. And agoraphobia, the fear of being in situation where escape might be intricate. And separation anxiety disorder is often associated with the children, but it can affect adult being able to separate each other. And number 7 is selective mutism, is where an individual cannot speak in specific situation despite being able to speak in others. And then substance medication induced anxiety disorder is where anxiety is a direct result of substance use. And then the number 9 is the anxiety disorder due to another medication condition where anxiety symptoms are linked to a medical issue. Well, recognizing these types of anxiety disorder, this types help clinicians provide targeted interventions based on each disorder specific presentation. So to diagnose this case, we can use the DSM-5. It can help us to figure it out what kind of anxiety it is. As the symptoms of anxiety disorder. Anxiety disorder manifests in various ways, affecting emotional, cognitive, and physical domains. The first one is emotional symptoms, as individual may experience persistent fear, tension, or a sense of dread, often feeling nervous or irritable without an apparent reason. And the second one is cognitive symptoms. It is anxiety can impair concentration and then leading to racing thoughts or moments when the mind goes blank. And then it's making it changing to focus on tasks or decisions. And the physical symptoms, it's anxiety, the body stress response, causing symptoms like a rapid heart rate, and then sweating, shaking, and then sometimes shortness of breath, and dizziness or muscle tension. Here is the diagnosis criteria for generalized anxiety disorder. I'm going to practice with you all under the title of this generalized anxiety disorder. So let's study together here. And to diagnose generalized anxiety disorder, the DSM-5 provide specific criteria. The causes of anxiety disorder. Anxiety disorder can stem from various underlying factors that interact and influence one another. Broadly, we categorize these causes into 3 main types. The first one is biological, psychological, and environmental factors. And the first one, biological factors, it includes genetic predisposition and imbalance in neurotransmitters. This means that some individual may be more likely to experience anxiety due to their genetic makeup, and which can influence brain chemistry and how the body responds to stress. And next is the psychological factors, as we have the psychological factors, which refer to maladaptive thought patterns. This could include, sometimes we can have a negative self-talk, low self-esteem, or the chronic worry about the unlikely events. This mental habits can reinforce and intensify feelings of anxiety over time. And then the third one is the environmental factors. Environmental factors are also significant contributors. Experience of, for example, like childhood trauma, stress, exposure to stressful situation, or ongoing life pressures like work demands or financial struggle can trigger anxiety. Understanding these factors help us appreciate the complexity of anxiety disorder and the importance of a comprehensive approach in the treatment, and which may address biological, psychological, and environmental influence. Here are the several risks of anxiety disorder. The several risk factors can increase the likelihood of developing anxiety disorder. The first one is family history of anxiety or a mental illness suggests a genetic component, making individual more susceptible. Additionally, a personal history of trauma or adverse childhood experience can have lasting effect, contributing to a heightened anxiety response in adulthood. And this chronic medical condition, for example, like the heart disease or diabetes, also play a role as they can add ongoing stress and physical vulnerability. And also substance use is another critical factor, as it can both exaggerate and trigger anxiety symptoms. And this factor highlight the importance of screening for this risk factor in clinical assessment, as I try to understanding the patient background, and then it can guide effective intervention and then support. And this emphasizes each factor's role in contributing to anxiety and the need for comprehensive clinical evaluations. The first one is cognitive behavior therapy. This one known as the gold standard for anxiety treatment, and then CBT focus on the identifying and changing distorted thinking patterns, and then it helps individual reframe negative thoughts and develop healthier responses to anxiety-provoking situation. And the second one is exposure therapy, and this involves gradually exposing individuals to anxiety-provoking stimuli in a controlled manner. By facing their fears, clients can reduce their anxiety over time and learn that this situation may not as threatening as they seem. And the third one is acceptance and commitment therapy. ACT encourage clients to accept their anxious thoughts rather than fight them. It's combined acceptance strategy with behavior change, helping individual focus on living in alignment with their value despite experiencing anxiety. And then as a counselor, we have to comparative effectiveness of the different therapies and discussing which treatment may be best and then suited for specific anxiety disorder clients. And then matching the therapeutic approach. What happened? Oh, it's okay. Matching the therapeutic approach with the individual's unique needs and preferences is important. This approach highlights the diversity in treatment options, allowing clinicians to personalize care based on each client's situation, symptoms, and needs. Here, as a counselor, we have to aware of the culture. of their clients. Here is a case study discussion. So this is a very short case study. What kind of anxiety it's going to be? Emily?
Maybe generalized anxiety disorder.
Yes, you're correct. Yes. So in this case, what might her diagnosis be?
I'm so proud of them. They're looking in their DSM book. I'm so proud of you guys. That's what you got to do sometimes.
Yes, Emily. I saw you raise hand.
Yeah, F41.1, generalized anxiety disorder.
So which one can help her to overcome her generalized anxiety disorder?
So would we apply CBT in this case? In our session, we'll practice different techniques to help her, breathe, relaxation, meditation techniques to help her to feel comfortable. Also teach her these techniques so she can apply them at home whenever she feels that she's about to have our her anxiety is becoming a bit overwhelmed. So these are some of the things that we would do as counselors for a client.
Yes, you're correct. So CBT could be effective in this case, and particularly in addressing her patterns of excessive worry. In her case study, we can read, and then providing relaxation techniques that you already mentioned about. And then additionally, mindfulness practice could help with stress management and increase her ability to relax, right? Yeah, I really appreciate for the volunteer answer the questions. Okay.
I have
Yeah.
a question. Would you also recommend that she does some exercises as well? Maybe go for a brisk walk? Because I was reading that exercise help with anxiety, stressors, and just mood disorders. Applying some incorporating exercise within her daily routine can also help with her getting back into Zen position.
Yes, you're correct. Yes, absolutely. I agree. Yeah, I just give some example of the treatment, but exercise is one of the treatment for the, anxiety disorder patient. So it can help her anxiety situation. So any comments on this case and then question, Dr. Chin? Would you like to add any comments on this?
I just love the questions. I love those questions. You guys are really doing some critical thinking. And you're right. I mean, with the excessive worry, then you're like, I wonder if you're feeling depressed because you're worrying all the time. So that makes total sense. So these are wonderful questions, guys. No, I don't have anything else to add to this.
Any question, comments?
Well, I must say that I truly enjoyed, and thank you for helping to simplify it for us, as well as for me just to reinforce that what I'm reading and understanding is actually I'm on the right path. So thank you so much.
Here are some challenges in treating anxiety disorder. During the anxiety treatment process, we may face some challenges in treating anxiety disorder. It comes several challenges. Sometimes treatment resistant in one issue where traditional therapy approaches may not work for all clients. That's according to our discussion. Sometimes like it's kind of this depression coming up, and then kind of situations happen during the session. Treatment resistant in one issue where traditional therapy approaches may not work for all clients, and then this prompt clinician to explore alternative or integrative therapies that might be more effective for the resistant cases. And another challenge is co-occurring disorder, as anxiety often exists alongside other conditions like depression, as we discussed already, and then sometimes substance abuse or the trauma. And then treating anxiety in isolation can be difficult when these other issues are also at play, necessitating or holistic approach. And then the third one is stigma. As a counselor, we must assess anxiety disorder empowers individuals to regain control of their lives improve their functioning and then enhance their overall well-being.